need to get back to normal too. But
whatever that's going to be.
yeah, I don't even know what that is.
Good morning. We're back this week to give you the latest news from our healthcare providers. Today we have Decatur Morgan Hospital Chief Nursing Officer Anita Walden with us. Anita, thank you for joining us today. And then from the Alabama Department of Public Health, Northern District, we have Assistant Administrator Michael Glenn. Michael, thank you for joining us.
Thank you, Mayor.
Okay. So just a little quick COVID-19 update. As of today, we have 15,000, right at 200 cases, total cases in Morgan County. This time last week, we had 14,941. So really what you're looking at there is we've seen an increase of about 200 cases just in a 1 week period. And as reported by the Alabama Department of Public Health, the moving 7-day percentage positive rate is 17.6%. Approximately 38,449 individuals have completed their vaccine series, and what we're seeing is a slight increase in those who are vaccinated.
Yes.
And for that, we say thank you. Because of the increase in the positive cases and hospitalizations, Decatur Morgan Hospital President Kelly Powers contacted me last week and recommended that we continue our Monday press conferences. We thought we had these press conferences in the history books, but now we've seen this increase, and it's something that we're hearing about across the nation, across the state, and here at home. So anyway, it's important that we come together and just make sure that we're updating the residents, our viewers, as to what's happening here in Morgan County. So Anita, if you'll provide a little update from the hospital, we'd appreciate that.
Okay. Thanks for having me. I appreciate it. We have today 13 patients in the hospital. Only 1 is in the ICU, and we have 0 in the ventilator. So that is the good news. Of those in the hospital, there were only 2 that had a vaccination prior to. So that's a little concerning. The same message that we have been saying for months now, please, please get your vaccination. That is the most important thing that you can do. Our average age of patients in the hospital today is 60, and we have seen that trend right along. These are not very old, and we actually have had those in their 20s and 30s. I have some today. So please be careful. If you are out and about, make sure that you distance, you wear your mask. I know that's not a very popular thing, but it's important to keep yourself safe. We are going to be utilizing our mobile medical unit to go out with vaccinations over the next few weeks. So watch our Facebook page, Twitter, and we will get that message out where we will be. We would like to go out to the people wherever they are. So if you have a group that has a need, please give us a call and we will do our best to get to you. Obviously, if there's a few, we still have our vaccine clinic over on the Parkway campus. So we take walk-ins, but if you'll call ahead, that's great. It gives us more information and makes sure that you get in and out in a timely manner. But we do take walk-ins, so if you happen to be by there and you want a vaccine, come by and see us. We have the Pfizer vaccine.
Okay, good, thank you. So the Pfizer vaccine, what's the starting age for being able to take the Pfizer vaccine?
You must be 12 and above.
Okay.
If you're 12 to 18, you need to have 12 to 14. You need to have your parent or guardians okay to do that.
Okay.
I should say 12 and 13. At 14, you can consent for yourself.
Okay. And then there's a questionnaire that you complete before you take the vaccine. So if there's health concerns there based on that questionnaire, may not qualify
we
for
may
the vaccine.
decline to give you a vaccine because it may not be safe for you until your physician has said that it's okay.
Okay. All right. Good. Well, this is encouraging. I'm curious. Have you seen anything? Patients who have received the vaccination who are hospitalized right now?
Yes.
Okay.
We have a couple.
Okay.
So just because you have your vaccination, that's not a guarantee that you're safe from getting COVID, particularly the new variant. However, we have seen it lessen your symptoms.
Which is good.
Which is good. So either way, it's very important to get your vaccine.
Okay. Thank you. Thank you. Mr. Michael?
Yes, sir. Well, all North Alabama counties at this point in time are considered high risk, which means community transmission is very high right now in all the North Alabama counties. The statewide positivity rate's a little over 21%, which is a little higher than Morgan County. So statewide, we are seeing a lot of community transmission going on right now. Testing is up at the health departments. Vaccinations are up slightly. We would wish that they would be up a lot more than what they currently are. All the health departments in North Alabama are giving vaccinations on a daily basis and testing on a daily basis as well. So if you need either a test or a vaccination, you can call the health department. They'll get you in that day usually for the vaccination. And then if you need a test, they will actually come out to the car and give you a test. Don't want you coming in the building, so we'll come out to you. We'll do a one-stop shop. Even if you have some mobility issues, if you'll notify the nurse when you get there, the nurse will actually come out and give you the vaccine in the car as well. So we're trying to do all we can to get as many people vaccinated in our communities as we possibly can, because that's going to be our key to getting back to somewhat normal stuff that we have. And just to kind of give you a little information about vaccination rates, those that are between the ages of 18 and 29, we only have a vaccination rate of about 25.9%. So about 3 out of every 4 people that you encounter in that age group is not vaccinated. And so if you're in a large group in that age group, about 3 out of every 4 in that group are not vaccinated. For those that are in the age group of 30 to 49, it's 37%. So about 2 out of every 3 in that age group is not vaccinated. And so we need for people to be vaccinated. Those that are over 65, about 74% are completed the vaccination series. But again, even in that age group, 1 out of every 4 have not been vaccinated. So we'd like to see those vaccination rates increase. That's going to be our key to getting out of this and getting back to some sense of normalcy. We've seen over the last month that the hospitalization rates have drastically increased statewide. As of yesterday, we had 1,451 people hospitalized throughout the state with COVID symptoms. That's the highest it's been in 6 months, since February the 9th. And so we're back right where we were in February. And so we need folks to be vaccinated. We need folks to take this serious. If you're not vaccinated, again, as Anita said, please wear your mask. And COVID is not transmitted through the chin. So if you're wearing your mask around your chin, it's doing of no value whatsoever. Please cover your nose and your mouth as you're out in public. Stay as far away from people as you possibly can. Wash your hands routinely. It's all the same stuff that we've been talking about for 1.5 years now of protection rates. And so we have ample vaccine available for everybody. As the hospital has just said, they have Pfizer and get you in the same day. The health department has Moderna and Johnson & Johnson, get you in the same day. So you not only have any vaccine you want, you can get it the same day. And so even at your local pharmacies, most of them have it now as well. And so it's readily available to you as the hospitals are taking their mobile units out. We encourage you, please get vaccinated. Talk to somebody that you trust, your local physician that you trust, your local pharmacist that you trust, somebody that's had the vaccine and has done well with it. Get somebody's story. And then if you know somebody that's had COVID, talk to them about what it was like to be in the hospital, what it was like, because just 2 weeks ago, we looked at some numbers this morning just to get a mind's eye view of what's going on here locally in Coleman and Jackson, Madison, Morgan, and Marshall counties. 2 weeks ago, we had 48 total people hospitalized in those hospitals. Last Friday was up to 81, and then this past Friday was up to 151. So in 2 weeks, we went from 48 to 151 people hospitalized. Folks, COVID's real. It's very contagious. It's highly transmissible, and in northern Alabama right now, all counties are at a high risk for transmission. Again, 3 out of every 4 people, 18 to 29, are not vaccinated in Morgan County. 2 out of every 3, 30 to 49, are not vaccinated in Morgan County. So if you are in a large group of people, the vast majority of those folks are probably not vaccinated. So you need to protect yourself, protect your family, and protect yourself, so that we can get through with this. I don't want football season to be canceled. I love Saturdays in the South. And so let's do what we need to do so we can watch football this year.
You know, it's just, I don't know, we came together for Memorial Day, Alabama Jubilee for the balloon races, and it was obvious that everyone was so excited to be back together again as a community. And then we had other events, and you could just, third Friday, and you could just feel it in the air that everyone was thrilled to be back. And now here we are kind of having to pull back again. Now on the Delta variant, and you may not be able to speak to this, is the transmission speed, is it faster?
What we understand right now, Delta is more contagious, but whether it's Delta, Alpha, Beta, or Gamma, COVID is highly contagious. It is whether you get the Delta variant or one of the other variants or whatever's next, it's very contagious and it's serious. And the good thing about it is the current vaccines that we have are good for all of them. And so those folks that have been vaccinated, if they do test positive, what we call a breakthrough case, those people tend to have very mild symptoms. And so you can either be very, very sick or mildly sick or none at all. And so the vaccination is definitely our key. I took the vaccine, my wife took the vaccine, all of the adults in my circle of influence, I try to get them to take the vaccine because I believe in it. I know it's safe. I've not grown a third arm yet, and so everything is going well with me. I've had no issues whatsoever, and so I'm thankful that I had the opportunity to take this vaccine. And again, if a booster comes available, I'll take it again if and when it does come available. And so I encourage everyone that's listening today, please get vaccinated.
Thank you. Now let's just again the age groups for the Moderna and the Johnson & Johnson.
18 and above.
And above.
Yes, sir.
Okay, and then the Moderna is a 2-shot.
Yes,
Uh,
4 weeks apart.
Okay, and then Johnson and Johnson.
One shot, you're done.
Okay, and I took the Johnson and Johnson whenever my time was right because Sherry and I had the virus and had no side effects from the Johnson and Johnson. Our family members immediate family members have all been vaccinated. But, here's the but, our 6-year-old granddaughter will start first grade Thursday here in the Decatur City school system. So Mom's been a little anxious about that. And so I think that they're going to hope that she's going to wear a mask to school. And then see what happens if she gets picked on or whatever happens in the first grade. Then they may have to adjust to that. But for now, I think they're going to start off with trying to wear a mask to school just to be on the safe side. Because she has no way of being able to protect herself, you know. So, well, do we have any questions? Lauren? Dion? None?
Hey, Lauren, do you have any questions for us?
Yeah, hey, so like everybody knows, school is coming back into session this week. Are we expecting there to be a bigger rise in cases with students getting back in the classroom together?
Can you repeat the question, Emmy, so everybody can understand?
Will there be a predicted rise in cases with school coming back into session?
Anytime there are groups of people that are together that are not vaccinated, we expect an increase in the number of cases. With that being said, again, as the mayor said, his family member is not eligible for vaccination at this point in time. If everyone who is eligible would be vaccinated, then most of these school-age kids would be protected. If they're protected all day long with a mask on at school and all the teachers are protected, then they're going home to family members who are not vaccinated, who have been out in the public. And so we encourage everyone who is eligible right now to be vaccinated so that those who are not eligible are protected. And so please vaccinate if you're eligible. Again, 3 out of every 4 Walden County 18 to 29 are not vaccinated. 2 out of every 3, 30 to 49 are not vaccinated. Those are school age parents. Please protect yourself so that you're protecting your children.
Lauren, do you have any other questions for us?
Yes, I have one more.
Okay.
So with most school systems not requiring masks, but also meeting in the classroom, do y'all see that changing anytime soon this semester?
Okay, updates on any mask policies for schools.
That would be for the schools school system to answer.
Absolutely, and the school systems have done an amazing job of trying to protect, putting up plexiglass, hand sanitizers. The school system is doing everything that they possibly can, and we need us to help them as well. And so again, please vaccinate if you're eligible so that we can protect our most vulnerable.
As we discussed last week, the Decatur City school system, as Michael just mentioned, but you were speaking of all in the district.
Absolutely.
But I'm very proud of the Decatur City school system and the excellent job that they did last year. I know that nothing can beat in-person instruction, but they will make wise decisions as it relates to the health and safety of our children.
I need to clarify. I was just thinking about my colleagues. So our mobile medical unit, let me clarify, we're going out to do testing because that's an easier way to do that and we can get to more people that way. We will take the vaccine out if there is a large group that needs to be vaccinated. But we don't want anybody to hesitate getting a vaccination depending on whether or not we're going to come to you. If you have an issue with transportation or whatever, please give somebody a call. Either give the hospital a call or give your local health department, thank you, words have left me, a call. We want to help you get vaccinated.
So with that, there was a time whenever y'all were doing the road show. And
Yes.
you're actually going to businesses
Yes,
and that had scheduled times with you
Yes.
to do vaccinating.
yes. We have gone to almost all the local industries and have done mass vaccinations there. So we wish we had done more, We did all that came to us.
Sure.
So, but we are still open for vaccinations at the Parkway campus vaccine center, so
Good. Thank you.
absolutely.
Lauren, anything else?
That's it. Thank y'all so much.
Thank you, Lauren.
Thank you. Well, listen, thank you for joining us today. We want to be efficient with our time. Remember, if you want to get vaccinated, you can always go beyond what you've heard today to vaccinefinder.org to help you locate one of the many vaccination locations in our community. Here's a challenge. Maybe you just don't want someone to know that you've been vaccinated. Be a closet vaccinator. Go get your vaccination. Don't tell anyone. Just do whatever it takes. But until next time, be safe. And man, be kind. We can use some kindness out there. Thank you, Decatur. See you later.